This video is about acromegaly, and it's a rare hormonal disorder that results when the pituitary gland produces too much growth hormone during adulthood. So the pituitary gland, also known as the hypophysis, is an endocrine gland that is about the size of a pea and is located at the base of the brain, and it produces a number of hormones. The pituitary gland is divided into two main sections: the anterior lobe, or the adenohypophysis, and then the posterior lobe, which is also known as the neurohypophysis. And these lobes have hormones that they produce. And growth hormone is one of the hormones produced by the anterior lobe of the pituitary gland. So in acromegaly, the anterior lobe produces too much growth hormone, and when this happens, the bones increase in size, including bones of the face, feet, and then hands. So the growth hormone plays an important role in managing physical growth, and when it's secreted into the bloodstream, it triggers the liver to produce a hormone called insulin-like growth factor 1. This insulin-like growth factor 1 will stimulate the growth of bones and other tissues. So acromegaly is caused by the pituitary gland overproducing growth hormone. So if the pituitary gland makes too much growth hormone, it can result in excessive amounts of insulin-like growth factor 1, and this will in turn cause abnormal growth of the soft tissues and skeleton, and can also cause other signs related to acromegaly. Most cases of acromegaly is caused by a pituitary adenoma, which is a benign tumor of the pituitary gland. The tumor secretes excessive amounts of growth hormone, causing many signs and symptoms characteristic of acromegaly. Some of the signs and symptoms of acromegaly, such as headache and impaired vision, are due to the tumor mass pressing on the nearby brain tissues. Pituitary tumors can either be micro or macro, depending on the size. And most growth hormone secreting tumors are macroadenomas, meaning they are larger than 1 centimeter. And depending on their location, these larger tumors may compress surrounding brain structures. For example, a tumor growing upward can affect the optic chiasm. So the optic chiasm is located right above the pituitary gland, and it is where the optic nerves coming from the eyes cross over to different sides of the head, enter into the occipital lobes, which interprets those visual signals. So when the macroadenoma grows upward, it can compress the optic chiasm, and the pressure on the optic chiasm will lead to a stereotypical bitemporal hemanopia, which is when there is loss of vision in the outer half of both the right and left visual fields. Rarely, acromegaly is caused by non-pituitary tumors. Tumors in other parts of the body, such as lungs, pancreas, and adrenal glands, can cause it. These tumors also lead to excess growth hormone, either because they produce it themselves, or more frequently because they produce growth hormone releasing hormone, which stimulates the pituitary gland to make growth hormone. One of the most common signs of acromegaly is enlarged hands and feet. And some people with this disorder often notice that they can no longer put on rings that used to fit, and that their shoe size has progressively increased. It can also cause gradual changes in the shape of the face, such as a protruding lower jaw and brow, an enlarged nose, thickened lips, and wider space in between the teeth. Other signs include impaired vision, headaches, enlarged tongue, menstrual cycle irregularities in women, enlarged liver, heart, kidneys, spleen, and other organs. Progression of acromegaly can result in major health problems. Some complications may include high blood pressure, cardiovascular disease, particularly enlargement of the heart, osteoarthritis, diabetes mellitus, sleep apnea, and carpal tunnel syndrome. However, early treatment can prevent these complications from developing. To begin the diagnostic process, a medical history should be taken and physical examination should be conducted. Some of the diagnostic procedures include measuring the levels of growth hormone and insulin-like growth factor 1. Elevated levels suggest acromegaly. Another diagnostic test is the growth hormone suppression test. So in this test, blood levels of growth hormone are measured before and after drinking a preparation of glucose. So normally, glucose ingestion depresses the levels of growth hormone, but in patients with acromegaly, growth hormone levels tend to stay high. Some imaging techniques like MRI can be done. It can help pinpoint the location and size of the tumor in the pituitary gland. Treatment is based on lowering the production of growth hormone as well as reducing the negative effects of the tumor on the pituitary gland and surrounding tissues. So transphenoidal surgery can be done to remove the pituitary tumor, and when it's removed, it can normalize growth hormone production and eliminate the pressure on tissues surrounding the pituitary gland. and this can relieve the associated signs and symptoms. Some drugs used to lower the production or block the action of growth hormone include somatostatin analogs like octreotide and lanreotide. So these are synthetic versions of the brain hormone somatostatin, and they interfere with the excessive secretion of growth hormone by the pituitary gland, and this will cause a reduction in the levels of growth hormone. Growth hormone antagonists like pegvisomant act by blocking the effects of growth hormone on the body tissues, and dopamine agonists like cabergoline and bromocriptine are also used to lower the levels of growth hormone and insulin like growth factor 1. So that brings us to the end of the video, but before you go, I would give you an MCQ to try. So here is the question. What is the most common cause for the overproduction of growth hormone in acromegaly? A. Lung cancer, B. Hypothalamic lesion, C. Pancreatic cancer, and D. Pituitary adenoma. So what do you think the correct answer is? You can leave your answer in the comment section and we'll discuss it in our next video. Finally, let's discuss the question from our previous video. So in the last video, we're looking at aspirin, and there was a question at the end of the video. So here is the question. Which enzyme is irreversibly inhibited by aspirin? A. Lipoxygenase, B. Cyclooxygenase, C. Thromboxane synthase, and D. Phospholipase. So the correct answer is cyclooxygenase. In the last video, we learned that aspirin works by irreversibly inhibiting COX enzymes. You can watch our video on aspirin to know more about it. Thank you so much for staying till the end, and if this video was helpful, kindly give it a thumbs up, share with your friends, subscribe, and also turn on your post notification bell so you don't miss any video we upload, and we'll be back with more videos.